Nurses endure a constant barrage of pages, beeps, and buzzes from everything from IV pumps to fall alerts. Alarm fatigue sets in due to the volume of alarms and not knowing where they are coming from. Yet out of this chaos, nurses must still ask many questions. What alarm is my responsibility? Which alarm has the highest priority? Is this another false alarm? Amplion Alert transforms chaos into order by alerting the responsible caregiver of events relevant to their individual patients. Amplion Alert identifies, organizes, prioritizes, and communicates alarm notifications to the appropriate caregiver via a wireless phone. It enables caregivers to confirm their ability to deliver the needed care or to request help. Care tasks and status are displayed on a large monitor at the nurses' station so clinical teams stay informed and accountable. The technology integrates and prioritizes alarms from a number of sources, interfacing with the hospital's existing equipment to track a variety of alerts. These include bed and chair fall alerts, vent alarms, infusion pumps, pulse oximeters, telemetry, nurse calls, bed turns, rounding, and pain assessment, to name a few. The system automatically prioritizes and reports specific alarm events and locations to the appropriate caregiver, confirms cancellation of the alarm, and then documents the care event. The primary benefits of this system to patients include a quieter environment, fewer patient falls, fewer pressure ulcers, and greater comfort in knowing their needs are being responsively met. What does this look like in action? With one recent customer, the use of Amplion Alert led to an 86% reduction in alarm messages. Importantly, the messages were sent to the assigned caregiver for that patient, allowing them to quickly respond to their patient's alarm condition. In the end, this meant that when these highly trained, highly paid staff members received an alert, they knew it was for their patient, and it was likely to be important.